Hello everyone, so the DTP practice demo today, you press on DTP practice for ORE, it opens up. Again, like the SCR, since the cases are a bit big, it does sometimes take a few minutes, not a few minutes, less than a minute, to load the entire case. Yeah, so DTP1, we have 26 DTPs, and we are in the process of adding more right now, and you have this picture. So what you're supposed to do is you're supposed to confirm the patient's name and write it here, confirm the date of birth and write it, and the address, okay? Yeah, so like the OSCEs, you just press the big red button and then you start speaking. Hello, my name is Dr. Youssef. I'll be your dentist for today. Can I please confirm your name, date of birth, and address? So the initial
Hello,
response
my name is Lisa Jordan. My date of birth is 3rd of March 1965, and my address is 64 George Road, London, Y2X76W.
64 George Road, London, Y2X76W. Thank you, Mrs. Lisa, and I'm very sorry, bear with me, I'm gonna be writing while you are speaking, but rest assured that my full concentration is with you. Can I please know what brought you here today?
I hate my denture.
I see. I'm very sorry about that, and I'm gonna try my best to help you out. Can you tell me what is the problem that you're facing with your dentures?
It's loose.
Okay. Has it been loose ever since you got it, or is this something recent?
It's been loose since I first got it.
Yeah, so basically we're gonna, go about taking the history, we're gonna go about asking all the questions. So this is a denture retention problem. So you're gonna have to ask all the denture retention questions and then make up a diagnosis. And then finish the blue phase, you click. So basically in the DTPs, you get feedback after each case as you go. It takes, again, just like all the other apps, the feedback takes a bit of time just because of how big the DTP is and the fact that the feedback is custom made to the transcript. Most important thing is that if it does take time, you don't, start clicking all over the place. Just give it the time. Yep, so greeting and rapport, good identification. Again, so basically like the OSCEs, has about 7 to 8 points to judge you on. So greeting and rapport, identification of the chief complaints. Obviously I didn't do that. History of the complaints, again, exploration of the complaints. Medical history I didn't take, dental history I didn't take, social history I didn't take, expectations and constraints, again, I didn't take anything. And this is the logical structure of the questioning. So basically how you are speaking, whether you are holding a natural conversation with the patient. So done, and proceed to yellow sheets. This takes you to the yellow sheets. Again, takes a minute to load, and you have to again write the patient's name, date of birth, and date and address. It's very important that you do this in all the phases. So the yellow sheets, you got the findings, so the teeth present, the BPE scores, the findings in general that you would get in the yellow sheets. And then you're supposed to write your provisional diagnosis here, the radiographs required here, and the special investigations that you would need, if any. And then again, click generate feedback, and then it compares your answers to the model answers that it has and tells you how you did. Again, obviously I didn't write anything, so everything is wrong. And then you click proceed to green sheets. So this flow of the DTP is exactly like the DTP exam for the ORE. And again, green sheets, so you get the final findings. So the vitality tests, the BWE index and everything. Again, patient name, DOB, date and address. The radiographic report, you have to do all of it. And then the treatment plan, so definitive, the preferred immediate. Yeah, so this is, we updated the structure of it to go with the new DTP structure. So in the new DTP structures, it tells you to write the definitive diagnosis. You already wrote the provisional diagnosis, so this is your chance to correct yourself if you didn't get the provisional diagnosis right. So you write the definitive diagnosis, you write the preferred immediate treatment plan, and the treatment plan options. So basically this question combines the immediate phase and the stabilization phase, and then and the preferred. So you write the immediate, and then you write the options, the long-term options, and then you pick the preferred out of those, but you write all of them in a single section. And then advantages, referral and medical link. The only difference is that medical link is not provided in the green sheets. You have to write it yourself, so you won't find a title saying medical link. And again, you generate feedback. Obviously, again, I didn't write anything, so everything is wrong. But what you do now is proceed to presentation, which is the final phase of the DTP. In this phase, you get all of the findings. So you get the green sheet findings, and then you get also all the answers that you wrote except the yellow sheets. Okay, so in the exam, you're going to keep your green sheets with you, and they're going to take away your yellow sheets, and this is exactly what we did in the DTPs. And just like the history taking in the presentation, you press the big red mic button and you start speaking. Hello, Mrs. Lisa. Sorry for taking so long. Right now, we did some investigations, and I am ready to explain all of the problems that you have and how we're going to treat them. Again, sometimes the first response takes a
thank
bit.
you.
So the first problem that you have is your denture being loose, and this is due to a combination of factors that mainly have to do with the design of the denture itself. So the hooks on the denture, there should have been 2 hooks, but there's only 1 hook. And also the denture, is not as extended as it should be around your mouth, so this is why it's loose. Now, to treat that, what we can do is we can provide you with a new denture, or we can explore a fixed option, a more permanent option if you would like.
Okay, what would you recommend then?
So you basically just go about presenting your case to the patient, and then again you click finish and generate feedback, and you will get feedback for the presentation phase on its own. Again, it just takes just a minute to gather everything. The DTP and the SCR are a bit slower than the OSCEs, just because of the amount of information in the DTPs, and the SCR is a lot more than the OSCEs. Yep. So again, obviously I didn't do anything. So this is the feedback that I got because I didn't do anything. but this feedback will depend on, how you did. That's it. That's the DTP simulator, and now you have demos for all 3 AI study buddy sections, and wishing you guys all the best.